Hi, my name is Joe Grider, and this is my research proposal presentation on early screening breast cancer and the improved health outcomes. So a little bit of background. The CDC states that the annual number of cancer cases will increase from 49% between the years 2015 and 2050. That's just a large number in general. It's something that, I think needs to be decreased, and we need to minimize how many people are getting cancer and just improving overall the quality of care. Overall screening as of right now for ages is from ages 40 to 50 is in 18-month intervals, and that's led to better health outcomes compared to patients who were not consistent with their screening or no screening at all. That made me think about, what are some disparities when it comes to screening? Some of them that I could think of were socioeconomic status, so people who are, living in in a low income bracket and may struggle to, find transportation to get to where they need to for screening, as well as just not being able to financially support themselves through, frequent screening that health insurance may not take care of. Also, access to care, whether with or without health insurance, or just geographically, maybe people don't live close enough where they can make a trip out every year or so, or every 6 months to get screening done to make sure that they're on top of it, as well as lack of information on screening. So people may not know how long they should go between scans, and how often they should be getting scanned based off of what type of family history they have or what risks are involved for them. So also just a little bit of facts about genetics for breast cancer. So this BRCA1 and BRCA2 are genetic mutations that can cause an aggressive form of breast cancer. Although it happens in less than 5% of breast cancer patients, we've seen more genetic testing happening recently, but there is a lack of testing being done on breast cancer patients or people with high risk. Usually to get prescribed genetic testing from your provider, it's generally due to an extensive family history of breast cancer or other cancers. Access is increasing, but the risk of incorrectly reading results without a genetic counselor is something that's very prevalent, because people may be able to get at-home kits, and getting the results then aren't going to be any use to you if you don't have an expert talking you through them. So through my research, the gap in knowledge that I found was the lack of knowledge of early screening done on patients. Is it actually going to help? Is early screening actually going to benefit patients and not just be a time sink and something that's going to, potentially lead to worse mental health outcomes and just the stress of living scan to scan? And also, is testing too much? Are we testing too much? Are we overdoing it? Is all this extra screening really going to lead to anything, or is it just something that's extra for a patient to have to deal with? And lastly, there's not many studies done on changing the time frame of when screening and testing is completed. So the research question that I propose today is, are there better health outcomes and less years of life lost for breast cancer patients completing screening and genetic testing earlier than the set standard guidelines that are in place today? Would there be an increase in average years lived for breast cancer patients? Ideally, would less treatments be needed for breast cancer patients? If they catch it earlier, could they be more aggressive in treatment approaches? And could that lead to better health outcomes? Is it a less financial burden on patients and their family for dealing with a breast cancer diagnosis if there's earlier screening and it's caught earlier, meaning that less chemo treatments need to be done? So filling in the gap for me, from my perspective, I'm a research coordinator. I'm a CRC for Dana-Farber. I consent patients for studies all the time. And right now I'm running probably at least 20 oncology clinical trials. And I have success running those clinical trials. So I feel like with my expertise, proposing this research study is something that would be very beneficial, and I think would be very useful to look into. So for the study design, we're looking at a quantitative research design. So looking at patients who screen early compared to those who do not, who are just on the set standard screening methods. The study will be long-term and will follow patients over the course of their care. So, you're looking 5, 10 plus years of following patients for this study and gathering information. Demographic information will be collected, questionnaires and surveys will be completed throughout the course of the study, and the study will follow patients, up until they're diagnosed and in remission or have been diagnosed and then unfortunately pass away. Recruiting patients will be done in the hospital setting, so brought up by doctors who are on study first, and then study staff would follow through with the consenting process. And ideally, we're looking for patients with a family history of breast cancer and patients that are younger than the regular age when screening occurs. That way we can, they can be randomized into either group and then start screening earlier than normal, or just have the standard of care. So the study design, so you're looking at 2 arms, so there's 1 control, 1 experimental. So the control group, like I said before, would receive the standard of care screening done at specific time points as it is done now every 18 months. Genetic testing would also be offered to patients to complete to see if they have any genetic abnormalities. And then the experimental group would be focusing on, they'd basically start screening as soon as they've consented, which should be about 2 to 5 years earlier than it's normally done. And genetic testing would also be completed for those patients. Both groups would be followed and have regular checkups with study staff. After getting genetic results from screening, study team will be in close contact with them through this whole process. If progression occurs or patient develop cancer, all the information will be collected and the patient will be able to get standard of care that wouldn't affect them on the study. And then also, lifestyle choices and other patient information will be collected regularly. Smoking history, alcohol use, and physical activity levels, just to see if that plays a factor in their care. So when it comes to interpreting the results, so on average, patients are diagnosed with breast cancer between the ages of 55 and 65 years old, and the 5-year survival rate for breast cancer is 90%. So we're looking to see if early screen increases the survival rate in the patients with the experimental screening versus the standard of care, and seeing if they do indeed live longer, and if treated earlier and screened earlier. Need to take into account what stage of breast cancer the participant has. So obviously someone with stage 4 and a much more aggressive form of breast cancer is going to have a lesser survival rate no matter what, even if they get early screening. But the idea with this study is that the early screening would lead to better health outcomes because you're catching it earlier and you're able to treat it sooner. Application and value of the results. So the NCI would have the results reported to them, and if early screening is beneficial, then we would proceed forward with looking at how we can start implementing that and working towards improving the health outcomes for everyone. So that is the conclusion of my research proposal on early breast cancer screening. Thank you very much.